Here is your question. All right. So if you have read and understood, considering it communication skills station, please begin.
Yes, hello, I'm Dr. Ahmed Abdo. I'm calling to speak to Mr. John, the vascular consultant, to ask him about referral a case of acute limb ischemia. Could I check that I'm speaking to Mr. John?
Hello, Dr. Ahmed. Yes, it's Mr. John. You can continue. What you have?
Yes,
I-
summarize your case.
Yes, Mr. John. We have a case of a female patient, 54 years old, admitted in our ward with a diagnosis of multiple mild diverticulitis, and she is improving on IV fluid and antibiotics. Suddenly, she suffered from acute ischemia, but her abdominal examination was free. Her abdomen were left, and we have done ECG that shown AF and preventricular complex. Her blood's ABG shows metabolic acidosis with hypokalemia, and we confirmed our diagnosis by arterial duplex that confirmed the acute limb ischemia. So we want to transfer this because we have no vascular consultant in our hospital.
So, Dr. Ahmed, is it urgent to send the patient today, or can we wait for tomorrow?
Yes, Mr. It's an urgent case of acute critical limb ischemia. I think it needs immediately intervention because we are afraid to lose her limb.
Do you need a cardiologist to review the abnormality in ECG you said?
No, I think this ECG changes is slightly because of electrolyte imbalance. We can check it later. But first, we have to deal with ischemia now.
What do you think of her diagnosis of diverticulitis?
Yes, we confirmed this diagnosis, and she improved with our treatment. If you mean that the cause may be mesenteric vascular occlusion, it will be considered. But at the time of now, there's no confirmation or manifestation to confirm this.
Yes. Do you want to scan her abdomen first?
Yes, we need to scan her abdomen for more confirmation and excluding anything else. But I think it will be better after transfer, not to waste time for her limb.
You just tell me that you will consider mesenteric ischemia. Why do you now excluding it? Could be mesenteric ischemia?
I can't hear.
You can hear me?
Maybe mesenteric ischemia. But we have done already abdominal examination, and her abdomen were soft and not tender. So we will do serial abdominal examination, and after transfer we can make a CT scan and with contrast and to exclude or confirm there is no mesenteric vascular occlusion.
But we not are sure about her renal function. If her renal function is not good, what will you do instead of the CT with contrast?
We can make renal function to make sure it's safe for a CT scan with contrast.
If it is not normal,
first,
consider it not normal.
if maybe we'll go for abdominal ultrasound.
Yes. Sure.
Or yes, good.
Okay. How could you manage this case?
My management plan is first I for AF and the AF found in ECG is to start cardioversion in our hospital and continue this during transfer. We will transfer here in an well-equipped ambulance, the CPR and DC shock and all equipment we need. For metabolic.
Yes, continue. Good.
Yes, for metabolic acidosis and hypokalemia, we have to manage it also, and for
Yes, acute lung injury.
Yes, I can. And if and before going to operative theater for managing her acute limb ischemia, I think we can start unfractionated heparin.
Yes. What is the dose?
What is the dose?
What is the bolus and the maintenance dose?
No, I can't remember. I will check and inform you.
Okay, and you can monitor this unfractionated heparin which investigation?
By BT and the APTT.
And what is your target?
How many seconds?
Okay, what will you tell her family?
I will tell her that she suddenly developed a disturbance in her lower limb circulation, and she need urgent intervention. And because we don't have vascular consultant here, we have to transfer her to the nearest place that have a vascular consultant.
Okay, you can send patient. Thank you.
Okay, thank you.
Okay. Good. At the end, you'll ask the patient to, you'll ask, because you're the consultant, so you'll ask the candidate to summarize everything that has been discussed. And then you can say, okay, send the patient.
Okay.
Right. Here, 2-3 questions were missed. When you asked about the new presumed diagnosis of diverticulitis, then you could have asked about the differential diagnosis that this candidate thinks patient is suffering from. And then you can also ask, when you asked about, could it be mesenteric ischemia? Next, you could have asked, then what is the new diagnosis? So because this is mesenteric embolus that you're suspecting,
Yes.
These are the 2, 3. Okay, very nice. And the condition that you asked the candidate to assume that renal functions are not normal was nice. You want to discuss anything about it?
Yes, that's my first phone call station.
Okay.
Any suggestion for improving myself?
Will give you. Thank you.